Hello, everybody. You're welcome to Beyond the Scrubs, a podcast where we look beyond the uniforms, beyond the shifts, and into the realities of what it's like to truly be a nurse outside your shifts. Today, I have with me a strong force in the nursing profession, a registered nurse who works in psychiatric care. He once led students in a school and served as the SCG president. Join me, make welcome Nurse Akintona Gbenga. Thank you for joining us here
Thank you so
today.
much for this opportunity.
Yes, it's so glad we are so glad to have you here. Okay, let's dial it back in time, shall we? Can you take us back to the moment where you really considered nursing, where you said, okay, I want to go for nursing? Was it passion? Was it something you've always had in mind from childhood? Or was it that thing that just wanted to help your parents gain their bragging rights? Ah, nurse Lamamio, nurse Lamamio, Emma Shireo. So what really brought you into nursing?
Truthfully, it wasn't about passion at first. It was actually because of the job stability that comes with nursing. Because I didn't want a situation whereby I would go to school and spend several years and graduating and finding it difficult to find a job. So I wanted something that would give me quick employment after school. And nursing is one of the lucrative profession that you can easily get job compared to other professions where some people would have to stay at home for about 6 months, about a year looking for a job. But you would agree with me that even the newly graduated nurses, they easily get job, except if you just want to further your education and you don't feel like working. So one other thing that made me go for nursing was because I was so inquisitive. I wanted to know why people actually fall sick and how do they treat these people, how to get well without having to rush down to the hospital or calling a medical professional for help. So I wanted to have that knowledge.
All right. Thank
Yes.
you. How inspiring. That's really inspiring. It's sounds realistic and practical. Which takes us to the next question. Uh, we know how nursing could be demanding. Nursing has a way of stretching us thin. So, have there been moments where you reconsidered nursing as a profession, where you felt like, I know if you do this kind of thing again, it'll not be me now, go can't kill, or like, has there been a time where you just felt, oh, maybe I would have to change, careers?
Yes, there have been a lot of moments where I think of changing my career as a nurse. I could remember when I was working as an emergency nurse in a particular hospital. You know, my very first day working there, the shift was so hectic. They rushed in a baby, a neonate, who was having birth asphyxia. So while I was trying to attend to that baby, they rushed in someone else who was bleeding profusely due to road traffic accidents. And while that was waiting outside, someone inside was also calling my attention to a drip that is almost finished. And I was like, this is too much for me. And there was, we were just two on duty that very day. So after that shift, I was just, at some point, I had to have a rethink that is not seen truly the way. I think I need to change profession at this point because considering the pay and a lot of things, it's really not encouraging. And it's quite difficult. It's hectic. It's a hectic, very hectic profession.
Yes, and having experienced such, and the day-to-day demands of nursing, what is that? What is your source of motivation? What is that well that you draw your motivation from as a nurse to keep going despite the challenges, despite the setbacks and everything? What's that thing that's kept you going?
Simply put, I would say what has been keeping me to stay in this nursing field is my patients. The fact that I can actually impact their life positively. I see patients walk into the hospital sick and leave doing very fine and well. It's something that gives me so much joy. So I feel, regardless of the difficulties I face in the profession, regardless of the little pay, there's still something to be proud of. Sometimes I feel like a hero, you know.
Superman. Okay, yes, that sounds like really nice because I believe that most nurses will give a good nod to what you just said. In a world, let me say, in a pandemic of nurses who just want to make the bag and leave the profession, it's satisfying to see someone like you talk about, being in nursing for the reward of a sense of fulfillment that comes with, you know, caring for your patients and all that. That's really inspiring. Yes. So this is one question with one of the most sought after answers from young nurses, upcoming nurses. So to upcoming nurses out there watching this show, what is that theme or what are those things that were taught in our textbooks, procedural manuals, or taught in school, but is completely different on the word, like in the practical setting? Once you get on the word and you start working, what you learned, and you're like, that's what now they do for here. It's different though. What are those things that you can actually share with us that are completely different from what we learned in nursing school?
All right, when I graduated from nursing school and I started working in a particular hospital, I got to understand this saying that nursing is an art and a science. You see, the science aspect of it is you attending classes, um, learning the theoretical aspects and the practical aspect. But the art aspect of it is how you actually display your nursing professionalism, and that is why you discover that some patients would prefer a nurse to give them to administer an injection rather than the other. They'll say, oh, I love the way this nurse actually attends to me. Oh, okay, I don't feel too much pain when this nurse attends to me. So you have to understand that life in nursing school is different from life on the ward, especially when you find yourself in the bedside as a bedside nurse. Because in nursing school we read to pass exam. This pharmacology, everybody writes nausea and vomiting to signs and symptoms. But when you start working, you discover that there are specific signs and symptoms to certain medications. There are some specific signs and symptoms that you need to look out for when you administer certain medications. You understand? So there is a lot to look out for when you start working. Life after school is totally different.
Thank you very much. You once served as the executive president of the student union at our psychiatric hospital. Um, how has, your service, what you learned, the values you learned from leadership, how has it affected, working as a nurse now? I mean, there are certain ways you have learned about people management, human resource management as a leader. How has that impacted your service or how you serve as a nurse now? Probably how you relate your interpersonal relationship with nurses, your interprofessional relationship with other health professionals. How has that helped you in your in you know carrying out your service in your service actually as a nurse?
Serving as the executive president of the Student Union Government really helped me to develop some leadership qualities because it was quite challenging, but it helped me to understand how best you can relate with people, how you can get people to do what you want them to do. Because I worked with wonderful experts, I wouldn't lie. So when I started working, I discovered that there is an aspect of interpersonal relationship even between nurses. So I've been able to balance that area due to the experience I had when I was an executive. Yes,
All
so I
right.
have a better interpersonal relationship with my colleagues at work.
All right. Thank you very much. Thank you. Um, this is something common. The next question I want to ask you is something common to every single person because the personal experience. Has there been or when was can you take us back to the moment when you had your most emotional experience on the ward. Probably something that really touched you, that happened on the ward, that really touched you or that impacted you in ways way beyond the uniform, that stayed with you long after the shift. Probably some people would talk about the death of their patient, some people would talk about um, their senior colleague impacting them. So, what is that one most emotional moment on the ward for you?
Well, I had several emotional moments on the ward, especially when I was practicing as an emergency nurse. There is a particular one that I can't forget easily. I think a young boy, was around 7 years old, was rushed into the ER by the mother. So I think he presented with generalized body pains and severe joint stiffness. So I think he was having a vaso-occlusive crisis. So
Hmm.
the pain was just so severe that the boy was actually groaning in pain. So after the immediate nursing intervention and all, the pain persisted. So I had to counsel the boy. I had to stay beside the boy. The mother was also seated beside him. She was weeping. So it got to a point that the boy held my hand. You know, he looked at me. He said, "Nurse, if I die, will this pain go away?"
Hmm.
At first, I was speechless because for him to have verbalized such a statement, that means the pain was actually unbearable. You know, I had to just summon the courage. I told him all will be well, we'll be fine. You know, so I kept on reassuring him. But it was quite unfortunate that we eventually lost the patient. I think about 1 or 2 hours after he verbalized that statement. You know, the mother was so sad. She was really crying. And to make the matter worse, I was meant to, perform the last office
Hmm.
of this particular boy. So, and that is why I get so angry when I see newly married couples who have incompatible genotype getting married. Despite, even before I started practicing as a nurse, they've been preaching, else educating people that you need to check your genotype before you get married. So it pains me a lot when I hear people of this generation still getting, married and they are not compatible. So that experience is something I find difficult to erase from my mind.
Mm. Yeah. Thank you
Yes,
so
so
much for sharing that with us. We appreciate that. Thank you very much. And to wrap it up, what is one thing to nurses watching us here now? What is that one advice that you have for nurses that are just coming into the profession? What is that one thing to look out for? What is that one thing to be cautious of, have in mind, be um, reminded of constantly, whether to be to see beyond. Some people want to just make the bag to see. What's that one advice? Let me just leave it to that. What's that one advice you have for nurses watching?
all right, I would like to say this, that there is an emotional aspect that comes in our nursing practice, and it is quite demanding psychologically, where you have to um, counsel the patients. And even though, there's this saying that if you're a nurse, once you are going to work, you drop whatever personal issues you have at home or at the hospital gate before you enter the ward. So it's not always easy, except you've developed this emotional intelligence to deal with it. So sometimes having your own personal issues and having to care for a patient wholeheartedly, performing, your nursing duties without having issues, it's always demanding. And you have to know how to regulate your mood at times, especially when a patient is in pain, you know. So there's an emotional aspect of nursing, and there is also physical and emotional burnout that nurses experience due to the workload. There's shortage of staff in most hospitals. Sometimes, in fact, if you get to most hospitals,
Mm-hmm.
you will see a nurse to about 20 patients.
Yes.
You see a nurse to even more patients, about 30 patients. So it is really exhausting, and you need to protect your mental health. You know, as a psychiatric nurse, I would say this: you need to protect your mental health. If you have any reason to rest, please take a break and rest. There's nothing like, oh, I'm a Superman in nursing. If you need to rest, please
Rest.
excuse yourself and rest. It is not being selfish. Self-care is essential. Yes, so that is a very important thing I would like to pass across to
Yes.
people who are thinking of joining nursing.
Yes. Thank you very much for the time with us today. God bless you for joining and your insightful bits. Thank you so much. We really do appreciate it. I believe that all the nurses watching here today have had one or two things to gain from what you said to us so far. Thank you very much, everybody, for watching. Catch you on the next episode.